Hi everyone, my name is Ginny and I'm the workshop leader for the Sugar Club. It truly saddens me that we're not able to have the in-person monthly workshops at the clinic, but I do hope everyone is safe and I hope you enjoy this video. I'm joined with David, Maria, Praveen, and Sonia. We're all volunteers at Dr. Curnew's clinic to discuss what is diabetes, symptoms, how we measure it, technology, and medications involved.
Hi, my name is Maria, and I'm going to start it off by talking a little bit about what diabetes is and the biological explanations behind diabetes. So, according to Diabetes Canada, it's essentially a disease in which your body either can't produce insulin or can't properly use the insulin it produces, overall leading to an excess of sugar in your blood. So there are two different types of diabetes, type 1 and type 2. Type 1 diabetes is when the body does not produce insulin, and it's essentially an autoimmune condition where your body actually attacks the pancreatic cells, preventing the production of insulin completely. And it mainly develops in children and young adults, even though it is sometimes rarely found in older adults as well, and only accounts for 10% of all those who have diabetes. Now, the other 90%, majority of the people who do have diabetes have type 2 diabetes. This is when your body produces insulin, but it's not used efficiently, and this is known as insulin resistance. It occurs when the body's cells actually begin to resist the effects of insulin and typically develops in adults after the age of 45, though it is also rarely seen in other individuals of other ages. Now, knowing these two types of diabetes, I'm going to go a bit into the different risk factors. Now, for type 1 diabetes, the exact cause is kind of unknown, but we do know that most of it is genetic and has something to do with inheritance. So if you have a family history of people with type 1 diabetes, then you are more likely to develop it. And aside from that, there are some research saying that exposure to viruses and other environmental factors could lead to the development of type 1 diabetes. But all in all, it's managed by taking supplemental insulin, like insulin injections. With type 2 diabetes, genetics still does play a factor, so having a family history of diabetes would lead to the likelihood of you developing type 2 diabetes as well. But age is another big factor, so if you're age 45 or older, and aside from that, high blood pressure, high blood cholesterol, being overweight or obese, and then having an unhealthy diet, lack of exercise, and smoking can all lead to the development of type 2 diabetes. And with all these risk factors, you can see that managing your lifestyle changes and making these changes is one of the big major ways to manage type 2 diabetes, and aside from that, having diabetic medications as well. Okay, so we talked so much about insulin, producing insulin, and not responding to insulin, but what exactly is it? Insulin is a peptide hormone produced and secreted by the pancreas, and it allows your body to use the sugar ingested from the food for energy or to store it for future use. So overall, it prevents blood sugar levels from being too high or too low and maintains it at a basal level. So as you can see here, hyperglycemia is when your blood sugar levels are too high versus hypoglycemia when they're too low. So now I'll be going to insulin signaling in more detail and see how it functions in our body. So first, in the muscle cells and in adipose or fat tissues as well, what happens is when you eat a meal, the carbohydrates in the meal are broken down to glucose molecules, and these glucose molecules enter your bloodstream. At the same time, eating this meal triggers your pancreas and signals it to secrete insulin, which also enters the bloodstream. And it's the presence of insulin that allows the glucose molecules in your bloodstream to actually enter the muscle cells. So insulin helps with glucose uptake, and once the glucose is in the muscle, it's either broken down for energy or stored as glycogen. So overall, this is how insulin lowers your blood glucose levels. So in the liver, it's actually kind of different in the sense that glucose uptake is actually independent of insulin. So glucose continuously enters the liver just as normal, and when insulin is produced, it actually promotes glycogen synthesis in the liver. So glucogen is stored in the form of glycogen, so by promoting the synthesis, more glucose is being stored. And insulin also inhibits gluconeogenesis, which is the production of glucose from amino acids in the liver. So altogether, insulin lowers the blood glucose levels by increasing storage and by inhibiting the production of glucose. So now that we know a bit more about insulin signaling in the body, I'm going to backtrack and talk about type 2 diabetes in terms of insulin resistance. So just to recap, insulin resistance is when cells in your muscles, fat, and liver don't respond well to insulin and can't take up glucose from your blood. So in the muscle cells, with insulin resistance, glucose won't be able to enter the cells. And then in the liver, insulin resistance leads to the reduction of glycogen synthesis and gluconeogenesis, so the production of glucose is no longer inhibited since the liver cannot respond to insulin. And altogether, this causes a buildup of glucose in the blood and your blood sugar levels begin to rise. Now, the body does try to cope with this resistance by producing more insulin, and if the pancreas can make enough insulin to overcome the cell's resistance, then your blood glucose levels can remain normal. But the eventual decrease in the pancreas' ability to produce insulin would lead to the development of type 2 diabetes. And prediabetes is actually the stage where the pancreas is trying to overcome, but is not enough to keep blood glucose levels normal. And then Sania will go a bit more into that in the future. Okay, so studies have shown that one of the main causes of insulin resistance is excess weight and obesity, as high amounts of free fatty acids in your blood can actually cause cells to stop responding to insulin. Now, the main causes of elevated free fatty acids would be consuming too many calories or carrying excess body fat in general. And in particular, the accumulation of visceral fats, which are fats and just generally excess weight in the abdomen area, so like belly fats, can also lead to insulin resistance. So reducing this in general and reducing body weight is one of the main management for type 2 diabetes, and it's why we always put an emphasis on exercising more and having enough daily activity. Now, other potential causes of insulin resistance could be increased fructose intake, inflammation, gut microbiota, and inactivity in general.
So in this section, we'll be discussing some of the warning signs of diabetes as well as what prediabetes is. So when we're talking about warning signs of diabetes, these are some of the symptoms that you might notice. So on the left here, we have hyperglycemia, which is essentially when your blood sugar levels are too high. And on the right, we have hypoglycemia, which is low blood sugar levels. So if you're hyperglycemic, you'll notice several different warning signs, some of them being dry mouth, increased thirst, weakness, headaches, blurred vision, and even frequent urination. So if you are experiencing one or few or all of these, do keep a note on those symptoms. On the right-hand side, we have hypoglycemic symptoms, which include sweating, irritability, hunger, lack of coordination, and sleepiness. So these are, you might notice, pretty common symptoms. For example, headaches or weakness might be something that you experience without even having diabetes. So it's really important that you keep track of these warning signs, as well as when you're having them, such as the time of day, including how often you're experiencing these symptoms. Keeping track of your warning signs in a specific way will help you and your physician sort of come together with a bigger picture of what your current state is in terms of your blood sugar levels. So, prediabetes is when your blood sugar level is higher than it should be, but it's not high enough for your doctor to diagnose diabetes. So, you can think of prediabetes as sort of that warning stage or the stage that happens just before diabetes, where it's pretty dangerously high, but not high enough to officially diagnose you with diabetes. So, the symptoms for prediabetes are very similar to those discussed earlier with hyperglycemia. So those symptoms include increased thirst, increased urination, blurry vision, and even fatigue. So again, it's really important that you keep an eye out on these warning signs in case you do fall into this pre-diabetes range. Now, we have discussed a lot of warning signs and symptoms, but one of the best ways to diagnose diabetes officially is by doing different tests, such as the HbA1c test, the fasting blood sugar test, and the glucose tolerance test. So when we are able to measure these different levels in your body, we can then sort of officially categorize your blood sugar levels as being normal, pre-diabetic, or diabetic. On the left side here, you'll see different ranges for different categories. So the pre-diabetes range is highlighted in orange, which you'll see is separated by the type of test. So what these specific tests are will be discussed in the next following slides.
So now that we've kind of discussed how diabetes comes to be, let's go into more of how we test for diabetes. So a few diagnostic tools are used in the context of testing for diabetes, particularly through your blood test. So you can see that in your blood work, usually when you get those charts back, you can see a few different levels that kind of allude to the same thing of like sugar levels in your blood, right? However, there are some key differences that can be distinguished between these different things, and it kind of raises the question of, wait, why are there those different types of tests? Like, for example, why is there an HbA1c test if we already have something like a glucose fasting, right? So I'll get into that right now. So basically, HbA1c, to start off with, is kind of like testing how much sugar is bound to your red blood cells. So just from like a very simplistic standpoint, your red blood cells actually have the ability to carry glucose, and they can live in your body for around 120 days, right? So for example, if you take an HbA1c test on a certain day, it can give you an accurate picture of how much glucose is bound to your red blood cells since they were alive, right? So that's kind of like what HbA1c is, and on the picture on the right, you can see that a comparison between a low HbA1c and a high HbA1c. So glucose is bound to red blood cells through a molecule called hemoglobin, and the more glucose that is bound to these red blood cells can indicate a higher level of saturation, or like a higher level of glucose in your circulation. And it can indicate high blood sugars, right? So that's kind of like how we test for different levels of HbA1c and what that all means. The second kind of aspect of diagnostic testing is glucose levels through glucose random and glucose fasting. So glucose random and glucose fasting, the main distinguishing factor between these two types of tests is how a patient is tested for it, right? So basically, glucose fasting, as the name says it, you're kind of in a fasted state. You haven't taken any sugar, or you haven't eaten anything before the test, and basically that can limit variables affecting short-term sugar level spikes. For example, a diet. For example, maybe dinner you've had prior to the test, it might have kind of coincided with your blood sugar levels, and it might not be the most accurate description. So that's why fasting is really important. Glucose random, on the other hand, doesn't really look for that. It's more of a random test that doesn't have that fasting component to it, so it doesn't limit for that variable. So just going back to HbA1c, I really wanted to ask the question of, based on what we learned about hemoglobin bound glucose, or like how glucose can bind to red blood cells, what can HbA1c tell us as opposed to the other two tests? So the big thing here is that, as I said before, your red blood cells have a lifespan of up to 120 days, right? So it can give you kind of a good picture of your sugar levels and your glucose tolerance for more of a long-term picture, right? So that's what it's kind of important for, and that's why we use it in conjunction with glucose random and glucose fasting. So now that we have an understanding of all these different types of tests, I really wanted to get into what these results mean. So although the numbers aren't as important to know as like what the ranges are, um, it's still worthwhile to go over kind of understanding where the line is drawn between like normal and high levels of blood glucose. And this is important for people that are being diagnosed with diabetes for the first time, or you've already been diagnosed and you're trying to control your blood sugar levels from a long-term perspective, right? So basically what we're looking at here is your HbA1c and your glucose fasting, and there are recommended guidelines on like what normal, pre-diabetic, and diabetic ranges are. So even if you want to take a picture of this and like keep it on with you, it would be a really useful tool to have, just because it does get confusing sometimes to like look at these numbers and not know whether it's like abnormal, normal, or high. And having these kind of ranges can give you a good reference. So HbA1c, just reading off the chart, is 6.5% or higher for diabetic range, and for glucose fasting, the diabetic range is 126 milligrams per deciliter or higher. So, for example, if I had 7.3 come up on my HbA1c, that usually would mean that I might have abnormally high levels of blood sugar, and I can be diagnosed with diabetes given that number, right? So again, it's good to have an understanding of the ranges and where the normal range lies, and that's where we want to get to, right? So yeah, it's good to just have an idea of that.
So in this section, we'll be talking a little bit about the technology related to diabetes, specifically talking about glucose measuring devices. So the first glucose measuring device that we'll be talking about is FREESTYLE LIBRE, and we have a quick video from them explaining their device as well as how it works.
We've attached the link to the YouTube video, which quickly explains the purpose behind this device, so feel free to pause this one and take a look.
So as you saw in the video, FREESTYLE LIBRE is a very user-friendly device. There's a couple of different advantages to this specific device and the reason why we chose to highlight it here. So first of all, it's very convenient. So it measures continuously and stores your glucose readings throughout the day and night so that you don't have to repetitively keep measuring it, which is very convenient, especially if you are constantly very busy and unable to do so yourself. Secondly, it's a discrete measurement, so it's painless and pretty quick scan, close to 1 second. So it does this through the sensor as you saw in the video, and that sensor can even do it through clothing, which again is very convenient and discreet as well. Thirdly, it's very easy to use, it's water resistant and can be worn while you're swimming or bathing or even exercising, which again sort of decreases the hassle on your end in order to measure your glucose efficiently. And finally, like I mentioned before, it's very user-friendly, so it shows you your current glucose reading, your glucose reading from the last 8 hours, as well as where your glucose is possibly heading, which is good to know as well, just so you can see the overall trend of your glucose rather than just your reading at that particular time. A few other devices that are available are also GlucoTrack and GlucoseWise. So these devices work very similarly to FREESTYLE Libre, and they have some similar advantages and similar methods. So you can also check out these devices as well if you're looking for something different.
Hello everyone, my name is David and I'll be walking you through the medication section of our Sugar Club workshop. So starting off with type 1 diabetes, anyone with this type of diabetes would need lifelong insulin therapy. So insulin can't be taken orally to lower blood sugar because enzymes in your stomach would break down that insulin, preventing it from acting in your body. Instead, you would need I've listed some of the different ways that insulin could be effectively used, and the first being injection. So you can use a fine needle and syringe or an insulin pen to inject insulin under your skin. You can fill the syringes from a bottle of insulin and give yourself a shot. You can pick a spot and rotate between the belly, thigh, butt, and even the upper arm. Insulin pump is the second option, and it connects to a tiny needle under your skin to provide a steady stream of insulin throughout the day. An insulin pen, as discussed earlier, looks like a pen, but it has a needle on one end. Some of these are pre-filled with insulin, while others have a container that you can replace. Other forms of consumption include an inhaler, an injection port, and a jet injector, but these are the most common uses and the most common ways of consumption that insulin is usually consumed. So moving on to elaborate on the types of insulin medications there are four really main types of insulin medications, and the first is short-acting or regular insulin. So examples of this regular insulin include Humulin R and Novolin R. The second type are rapid-acting insulin. Rapid-acting insulin examples are insulin glucolicin, insulin lispro, and insulin aspart. Intermediate-acting or NPH insulin include insulin NPH, such as Novolin N, Humulin N, and long-acting insulin, including insulin glargine, insulin dedamer, and insulin degludec. Please note that all these medications should be accompanied by frequent blood sugar monitoring, eating, of course, healthy foods, exercising regularly, and maintaining a healthy body weight. So the goal is to keep your blood sugar level as close to normal as possible to delay or prevent any kind of complication. On the next slide, we can see on this graph a visual representation of how short, rapid, intermediate, and long-lasting insulin medications have an effect as time in hours increases. So we can see that rapid insulin peaks relatively quickly but drops almost as soon as it peaks, lasting around 9 hours. For the short or regular insulin, the curve is drawn out and the effects last for around 10 hours. We can continue the trend with intermediate and long-lasting insulin, seeing the trend continue as expected, with intermediate being somewhere in the middle and long-lasting obviously lasting the longest. There are also other medications that can be prescribed to those with type 1 diabetes, such as high blood pressure medications. So your doctor may prescribe angiotensin-converting enzymes, or ACE inhibitors, as well as angiotensin II receptor blockers, ARBs, to keep your kidneys healthy. These medications are recommended for people with diabetes who have blood pressures above 140 by 90 millimeters of mercury. Also, we can use aspirin daily to protect your heart, as well as any cholesterol-lowering drugs, including Lipitor and Crestor. Moving on to type 2 diabetes, some people who have type 2 diabetes can achieve their target blood sugar levels with diet and exercise alone, but many also need diabetes medications or insulin therapy. The decision about which medications are best usually depends on many factors, including your personal blood sugar level and any other health problems you might have as an individual. So there's no really one way to prescribe certain medications. It just has to be on a case-by-case basis. Your doctor might combine drugs from different classes to help you control your blood sugar in several different ways. One of these ways is by guanides, including metformin, which decrease glucose production in the liver and improve your body's sensitivity to insulin. Generally, metformin is the first medication prescribed for type 2 diabetes. It allows for more efficient use of insulin, and it even reduces risk of heart attacks and stroke. Some common side effects include nausea and diarrhea, and these side effects may stop as the body acclimates to the medicine or if you take your medicine with a meal. If metformin and lifestyle changes aren't enough to control your blood sugar level, other oral or injection medications can be added. Next, we have DPP-4 inhibitors, and these prevent the body from breaking down hormones that give the pancreas the go signal to produce sugar. These do not cause hypoglycemia or low blood sugar, but they do result or can increase your risk of heart failure. Some common side effects include joint, muscle, or back pain, nausea, and diarrhea. Usually these are added on top of other drugs like metformin to have an overall increased effect. So they're not usually taken by themselves, but they work in conjunction with other diabetes medications. These medications do help reduce blood sugar levels, but they tend to have a very modest effect. They don't cause weight gain, but they may cause joint pain and increase your risk of pancreatitis. Finally, although there are many other medications that can be prescribed for type 2 diabetes, the last one that we're going to take a look at is sulfonylureas, which increases insulin release from the beta cells in the pancreas, so that these medications do not help those with type 1 diabetes. The side effects include low blood sugar and weight gain, and some examples are glypuride, glipizide, and glimepiride. In addition to diabetes medications, your doctor might prescribe low-dose aspirin therapy as well as blood pressure and cholesterol-lowering medications to help prevent heart and blood vessel disease.
Thank you for watching this video. If you've enjoyed it, I encourage you to watch the second video where we discuss more of the management aspect of diabetes, so diet and exercise, how to cope with stress, and also the importance of staying hydrated. And I hope everyone stays safe, and thanks again.